Hello, I'm Dr. Leibovitz, and we're going to review the instructions needed for post-operative care for a nail procedure using collagen. Collagen has been an amazing substance that has been very helpful. It reduces the overall healing time almost in half and decreasing discomfort. It absorbs a great deal of fluid, approximately 60 times its weight, so it dries out the area much sooner, and when it does dissolve in that fluid, it provides kind of a scaffolding or matrix for the soft tissue to hold on to and fill in that area. This is a review of the instructions for taking care of a post-operative nail using collagen, and also the instructions for soaking. Now, every other day you'll be soaking the foot in room temperature or cool soapy water, and either use antibacterial hand soap or dishwashing soap, the non-scented citrus type, so you don't create burning. And it's just mildly sudsy. So when you soak, you're going to soak for 10 to 15 minutes. And when you're soaking, I want you to actively open and close and massage the borders and the base. If it's a partial nail, you'll just do the edges. If it's the entire nail, you'll do the base and the edges. And that will allow fluid to flush in and out and help clean the area. And while you're doing that, and towards the end, I want you to take a Q-tip and gently spin and sweep the edges out. That will get all the debris and junk out of the corners, and it should peel off relatively easily. When you're doing that, you should see easily into the borders as we did it during the procedure. If it looks like it's filled up, there may be the jelly covering, and you want to be a little bit more aggressive than with spinning that to get that out of there. Once complete is when you'll apply the collagen. On the collagen, you're going to recommend taking a folded piece of paper, and you'll apply the collagen to the paper, and instead of pouring it from the envelope, which can get quite messy, and the collagen is pretty expensive stuff, so this will save a lot. So when you apply that, you're going to take the toe and you're going to tap the paper so it dispenses the powder. And if it's just the border, we're just going to keep a snow pile, and a rather liberal pile on the edge. If it's the entire nail, you'll cover it up. And remember, this will absorb about 60 times its volume in fluid. Now, also look on the back of the paper you got from the office. The instructions are also in written form on the back of the paper. After that, you'll cover it with a piece of gauze if it's within the first 2 weeks and there's a lot of drainage. If it's after 2 weeks, then you may not need that. And then you'll apply either using a small piece of tape or a band-aid covering the area. I'd recommend using the cloth band-aids. Refrain from using the plastic band-aids. They can irritate the skin even more. And that's your instructions. Happy healing.